Hi, my name is Tammy and I'm the director of BrightStars. BrightStars gives parents information to select high-quality childcare and early learning programs for their children. We assess programs based on high-quality standards and assign them a rating of 1 to 5 stars. We work with those programs over time to learn about best practices and really provide the best high-quality care for children and families. Smith Hill Early Childhood Learning Center is one of over 50 programs that BrightStars is working with to ensure high-quality childcare and early learning for children in Rhode Island. We know what the research says, that high-quality childcare really matters. The early years are the learning years, and it's when children grow and develop school readiness skills that are important in the school age years and throughout life. Programs like Smith Hill voluntarily sign up to be a part of BrightStars. They want to know what their strengths are, and they want to know some areas that they can improve on. So we come in, we do an assessment based on our high quality standards, and then we work with the director, the administrative staff, and the teaching staff over time on those areas that they would like to improve on. I'm Tammy Camillo. I don't just wear the shirt, I live it.
I'm Tony Maione. I'm the president of the United Way in Rhode Island. You've just seen the stories of some lives of people who have been touched, who have been helped by the work of our United Way. None of that work can happen unless we all come together to give, to advocate, and to volunteer to make our community a better place. So I'm asking you to give, to advocate, to volunteer, to live united, to make Rhode Island the best possible place that it can be. Thank you.
My name is Don Boucher. I'm a program director for Riverwood Mental Health's Housing First program. In December of 2005, we partnered with the United Way of Rhode Island to end homelessness. Research found that if we did nothing with this population at all, just let them stay in the shelters and let them stay on the streets, they cost the state in one way or another $30,000 per person. We had this radical idea. The idea was to rapidly house people who were living on the streets and who had been languishing in shelters for many years and give them their own apartment. Our first placement was in April of 2006. As of this date, there are now 140 persons who are living in permanent housing. The program is a success no matter how it's measured, but the most important thing is it's changing people's lives. One of the exciting things about the program is that it saves money. The costs are now about $20,000, and that includes both the subsidy and the services that we provide. We have 3 psychiatrists that work for us, we have 3 nurses that work for us, we have 12 or 13 different case managers, substance abuse specialties. The whole person is really looked at in a very comprehensive way, and they're getting treatment and people are succeeding. If you will work with us and support United Way of Rhode Island, we can live united together and end permanent chronic homelessness in Rhode Island forever. My name's Don Boucher, and I don't just wear the shirt, I live it.
I'm Tony Maione. I'm the president of the United Way in Rhode Island. You've just seen the stories of some lives of people who have been touched, who have been helped by the work of our United Way. None of that work can happen unless we all come together to give, to advocate, and to volunteer to make our community a better place. So I'm asking you to give, to advocate, to volunteer, to live united, to make Rhode Island the best possible place that it can be. Thank you.
I'm Andrew Cortez, Director of Building Futures. And Building Futures was started on the promise that there are actual solutions to our problems. There's such high unemployment, there's such poverty in our neighborhoods, and we know that there's a way to get at these. We do it by running a comprehensive initiative. We work with the project owner community, and those are the folks who design construction projects and have the need for a skilled workforce, who need productive employees who are on task and focused. And then we work with low-income people who are disadvantaged, who need the power of the opportunity that we can offer. I can think of so many who have come to us with children looking for the opportunity to support their family, and that's where we can help. We have hands-on activities. We have classroom-based activities. We teach people theory. We teach people how to use the tools and how to build their own tools. Financial literacy, how to save their money, how to budget, how to stay on task and focus 40 hours a week and make that family-sustaining wage so they can help. We understand what it means to live united. We hope that you do too, because when you give a small gift, it makes a huge impact. There's a ripple effect. One small investment here, $1 here, can return 10, and it can help people. It can transform our neighborhoods and the quality of life for us all. My name's Andrew Cortez, and I don't just wear the shirt, I live it.
I'm Tony Maione. I'm the president of the United Way in Rhode Island. You've just seen the stories of some lives of people who have been touched, who have been helped by the work of our United Way. None of that work can happen unless we all come together to give, to advocate, and to volunteer to make our community a better place. So I'm asking you to give, to advocate, to volunteer, to live united, to make Rhode Island the best possible place that it can be. Thank you.
My name is Shannon Heenahan, and I'm a call specialist and resource specialist for the United Way 211 of Rhode Island. 211 is an information and referral social service hotline. People call us with a need and we help them connect with the appropriate services to help them. We also help in disaster situations, even during something like the flood of 2010.
I received a phone call a couple days after the flood, and there was this guy, his home was condemned. He needed emergency housing, he needed help.
I received a memorable phone call from a woman who needed assistance with cleanup, as well as assistance with mental health. We were able to get her connected with people to help her clean her home.
I received a call from a gentleman who was undergoing chemotherapy. He was staying at his home by himself, pumping out his basement day after day, and I was there reassuring him that he was taking every step possible he could.
I was able to refer him to his community action program.
We were able to refer her to the appropriate people for cleanup, as well as get her the help she needed for her mental health.
It was good to be there for him just because he had nobody else to talk to. His family was gone. He was at the home by himself without any electricity.
During the floods of 2010, we received 33,000 calls in 30 days and made follow-up calls to 15,000 people to see if they needed more help. 211 doesn't only take calls during a disaster. We also help with things like food, shelter, and senior services.
My name is Shannon Heenahan, and I don't just wear the shirt, I live it.
I'm Tony Maione. I'm the president of the United Way in Rhode Island. You've just seen the stories of some lives of people who have been touched, who have been helped by the work of our United Way. None of that work can happen unless we all come together to give, to advocate, and to volunteer to make our community a better place. So I'm asking you to give, to advocate, to volunteer, to live united, to make Rhode Island the best possible place that it can be. Thank you.